I live with 3 different chronic health conditions: multiple sclerosis, type 1 diabetes, and breast cancer. Juggling the 3 is quite a challenge. And I guess it was within 2 years of my diagnosis with MS that I decided to leave my chosen field of documentary filmmaking. And one of the first things that we were both concerned about was the financial situation, because we had gone from a household, Moira, my partner, and I, of 2 good income earners to 1. I finally did apply for a disability pension through the help of a social worker who showed me the process, and it's based on your contributions to the QPP. What you receive in the end is based on what you've given over your lifetime earnings, and you're allowed to top up what you receive from the QPP to a ceiling of $2,000. So that's not a lot, and it was a lot less than we were used to having as our income. But at least it allowed me to look for a part-time job.
Well, in addition to there being less money coming in, there were added expenses. We started to need to spend more money on transportation, on help around the house. We ended up hiring a housekeeper. There was, Tricia's balance isn't the best, so she had a couple of falls. It meant that she ended up in physiotherapy for extended periods of time. And just, other healthcare professionals who helped us out. Some of them were free, but some of them cost, and they were things we needed. Well, in Quebec, it's mandatory that you have prescription drug insurance, and either through the private sector, if you have access to it, or through the public sector, through RAMQ. Also, one of the drugs that Trish was taking for MS was so expensive that even with private insurance, we were paying close to $5,000 a year for prescription drugs out of pocket. And we knew that in Quebec that there was a ceiling, a cap on how much an individual should be paying for prescription drugs. And it was somewhere around, at the time it was about $1,000. I think it's about $1,100 now. So we felt like we could lower our expenses.
It wasn't easy to get that to work. We knew in principle that was right, but when calling up RAMQ, it took so long to find the right person who would speak to us and really help us.
I think you spent about 2 years making phone calls every few months because we'd hear from people. People in my HR department, people at the toolbox, who said, no, you're paying too much. So every couple of months we'd make phone calls, mostly Trish, and we'd run up against dead ends. But then just one time she ended up with the right person, and he finally understood our situation, did some research, and determined that this drug was, in fact, classified as an exception. And because of that, it allowed us to enroll in RAMQ and keep our private insurance for supplementary coverage. So insurance programs can be bureaucracies, which can be hard to navigate. So it takes persistence and patience and staying calm on the end of the phone. And you need to do some research to understand what your rights are and to understand what you're entitled to. When there's a lot of people involved, your specialist, your medical specialists, your pharmacy, The drug companies can be involved, the administrators at the insurance companies. It takes a lot of juggling and a lot of persistence. But, it paid off for us. When a new drug or exceptional drug or medical technology is prescribed, your medical specialist has to fill out forms, send them to the provincial medical plan or drug plan, and sometimes there can be a gap in coverage. This happened to us recently where Trish needed her blood glucose continuous monitoring system, and the paperwork hadn't come through, so we had to pay for those things up front out of pocket, and eventually we were reimbursed, but not everybody has the means to pay up front for drugs that they need. Any and all relationships can be challenging, and adding a layer of chronic illness and managing that can bring stress. When I met Trish, she was a type 1 diabetic. Many years into our relationship, she was diagnosed with MS. That, of course, was a surprise and a bit of a shock to us. A few years later, she was diagnosed and treated for breast cancer. And, we adjusted at every point. Late in 2018, I was diagnosed with breast cancer. So I had been the healthy one, and all of a sudden I was in treatments. So you never know. It can happen to all of us, any of us.